The consistency trap. Why intermittent use may undermine GLP-1 weight loss drugs. New research suggests that the stop-and-start approach to weight loss medications like Ozempic and Wegovy may be counterproductive. A study from the Perelman School of Medicine at the University of Pennsylvania indicates that taking frequent breaks from GLP-1 drugs could reduce their long-term effectiveness and alter how the body responds to treatment. The problem with stop-and-start therapy, while GLP-1 drugs have revolutionized weight management, maintaining a consistent regimen is a significant hurdle for many. In the United States, approximately 1 in 8 adults has used these drugs for weight loss, yet more than half of users stop their therapy within 24 months. Frequently, these users attempt to restart the medication later, assuming they can simply pick up where they left off. However, a preclinical study published in the Journal of Clinical Investigation, Insight, suggests this cycle may be less effective than continuous use. Research findings. The cost of inconsistency. To investigate this, researchers conducted a 4-month study using overweight mice to compare 2 different treatment methods. Continuous treatment. One group received semaglutide, a GLP-1 medication, consistently throughout the study. Intermittent treatment. A second group followed a stop-and-start pattern, taking the drug for 2 weeks, pausing for 2 weeks, and repeating this cycle before moving to continuous use. The results revealed a clear disadvantage for the intermittent group. While both groups saw initial weight loss, the intermittent group regained weight during every break. Upon resuming the drug, the intermittent group could not reach the same low weight achieved during their first cycle. By the end of the study, even after 2 months of steady treatment, the intermittent group remained 20% heavier than the group that had never stopped. The biological mechanism. Protecting muscle mass, the study suggests that the reduced effectiveness isn't just about weight regain, it's about body composition. Weight loss on GLP-1 drugs typically consists of roughly 60% fat and 40% muscle. When users stop the medication and regain weight, the majority of that weight is fat. This creates a dangerous cycle that shifts the body's balance. Researchers identified a phenomenon described as a muscle floor. Through MRI monitoring, they observed that the body appears to send biological signals to prevent further muscle loss once a certain threshold is reached. Essentially, the body begins to resist weight loss to protect its remaining muscle mass, making it harder to achieve significant results in subsequent treatment cycles. What this means for patients, while these findings are based on animal models and require further human clinical trials, the implications for medical practice are significant. The research highlights 2 critical areas for future focus. Long-term commitment. GLP-1 medications may not be the ideal choice for individuals who struggle with daily or weekly medication adherence. Muscle preservation. To combat the diminishing returns of these drugs, clinicians may need to emphasize strength training and high-protein intake to protect muscle mass during the weight loss process. The effectiveness of these medications may depend heavily on consistency, notes Dr. Thomas H. Leung of the University of Pennsylvania. Taking GLP-1s may be one of those decisions that people need to discuss and make with their doctor. Conclusion: intermittent use of GLP-1 drugs can lead to weight regain and a biological resistance to further weight loss. For these medications to be most effective, consistency and strategies to preserve muscle mass are essential.